Welcome to the TOEFL Listening section. In this part, you will hear one or more conversations in an academic or campus context, such as a discussion between a student and a professor, or between two students. You may take notes while listening. Listen to part of a conversation. You will hear it only once, so listen carefully. After the conversation, you will answer questions about what you heard. Some questions will ask you about main ideas and details. Others will ask about implied meaning, speaker attitude, or how ideas relate to one another. Use both what is stated and what is implied to answer.
Good afternoon, Dr. Morales. Thanks for meeting with me during office hours.
Good afternoon, Marcus. No problem. You said you wanted to talk about community intervention models for your thesis. Where are you in your planning?
I have narrowed the problem to youth violence in two neighborhoods. I want to compare two community intervention models, but I am unsure which models are most appropriate and how to assess them.
That is a focused problem. When you say community intervention models, do you mean theoretical frameworks such as the ecological model, asset-based community development, or structured approaches like collective impact and steering coalitions?
All of the above. I like the idea of collective impact because it coordinates multiple stakeholders, but asset-based community development appeals to me because it builds local capacity rather than imposing outside solutions.
Those are distinct approaches. Collective impact emphasizes a common agenda, shared measurement systems, mutually reinforcing activities, continuous communication, and backbone support. Asset-based community development starts with local strengths and leaders.
How would I choose between them for an evidence-based comparison? I want my work to be useful for practitioners.
Start by matching model assumptions to community context. Collective impact tends to work when there are multiple existing agencies willing to coordinate and when systemic barriers require alignment. Asset-based approaches work well where grassroots capacity is present but underutilized.
In these neighborhoods, there are several nonprofits, but trust with residents is low. That makes it tricky.
Exactly. You might consider a hybrid intervention that uses asset mapping to engage residents first, then builds a collective impact structure to coordinate services. That would be a community intervention model combining participatory engagement and system alignment.
A hybrid sounds promising. How do I make it evidence-based? Randomized controlled trials are difficult in community settings.
True. Evidence-based does not mean only randomized trials. Use a hierarchy of evidence and triangulate methods. You can implement a quasi-experimental design with matched comparison neighborhoods, along with qualitative participatory action research to capture process and context.
So combine outcomes evaluation with process evaluation?
Yes. Outcomes evaluation will show whether violence indicators change. Process evaluation, including measures of implementation fidelity, stakeholder engagement, and community readiness, explains why the model did or did not work.
You mentioned implementation fidelity. Could you explain why that is so important for community intervention models?
Implementation fidelity tells us if the intervention was delivered as intended. If fidelity is low, then poor outcomes might be due to weak implementation rather than a flawed model. That distinction affects recommendations for policy and practice.
That makes sense. For measurements, should I use standardized fidelity checklists, observations, or self-reports from practitioners?
A multi-method fidelity assessment is best. Use structured observations, document review of meeting minutes and plans, practitioner logs, and resident feedback. That improves validity.
What about outcomes indicators for youth violence? Arrests data are available, but they are limited.
Complement administrative data like arrests and hospital admissions with school absenteeism, self-reported incidents from youth surveys, and qualitative narratives from community focus groups. Use a logic model to link activities to short-term, intermediate, and long-term outcomes.
I was thinking of including measures of social cohesion and collective efficacy as intermediate outcomes. Are those appropriate for community intervention models?
Yes, collective efficacy is a key mediator. Many community intervention models aim to increase perceived social control and mutual trust. Measure those with validated scales and link changes to reductions in violence.
You mentioned community readiness earlier. How does that factor into selecting or adapting a model?
Community readiness assessments inform adaptation. If readiness is low, start with engagement and asset-based strategies to build capacity. If readiness is high, you can implement more structured interventions more quickly. The community readiness model gives stages that guide sequencing.
I worry about sustainability. Many interventions show short-term gains but then fade after funding ends.
Sustainability should be a design priority. Build local ownership, diversify funding, and create policies that institutionalize effective practices. In your methods section, include indicators of sustainability, such as local leadership transition, ongoing funding sources, and policy adoption.
One practical question about data collection. How do I balance rigorous measurement with maintaining trust so residents do not feel over-researched?
Use participatory data practices. Co-design surveys with residents. Provide clear benefits such as community reports and minimize intrusion. Combine brief, standardized measures with deeper qualitative interviews conducted by trusted community partners.
Can you give a concrete example of a community intervention model that combined these elements successfully?
Yes. In a mid-sized city, a coalition used asset mapping to recruit resident leaders, then implemented a collective impact approach to align schools, police, and youth services. They used match comparison neighborhoods and a mixed methods evaluation. The study documented increases in community cohesion and a modest decline in youth arrests over 2 years, with fidelity tracked via meeting attendance logs and observed program sessions.
That example helps. For my thesis, I could plan a phased approach. Phase 1 would be asset mapping and readiness assessment. Phase 2 would be coalition building and pilot activities. Phase 3 would be full implementation with evaluation.
A phased approach aligns with implementation science. Also specify adaptation rules. Document which components are core and must be delivered with fidelity, and which elements can be adapted to local culture.
Should I include cost analysis as part of the evaluation?
If resources allow, yes. A basic cost analysis helps policymakers decide about scaling up. Even simple cost per participant estimates improve the applicability of your findings.
This conversation clarified many aspects. For my proposal, I will outline a hybrid model, a mixed methods evaluation, fidelity measures, readiness assessment, and sustainability indicators.
That sounds comprehensive. Send me a draft logic model and your proposed instruments, and I will give detailed feedback. Remember that evidence-based community intervention models require attention to context, process, and outcomes.
I will. Thank you for the guidance, Dr. Morales.
You are welcome, Marcus. I look forward to reading your draft.
Listen again to part of the conversation. Then answer the question.
It is not enough to say a model was used. We need to measure implementation fidelity to know if outcomes can be attributed to the model.
This concludes the conversation portion. For more TOEFL practice tests and study materials, visit Spinta.org.